Hello medico people. So today we are going to learn about necrosis. So what is necrosis? It is a pathologic process that is the consequence of severe injury. What is it? It is a pathological process that is a consequence of severe injury. Okay. So what is it? Is a pathological process that is a consequence of severe injury. So what are the causes of necrosis? Causes. So firstly, it is due to loss of oxygen supply, that is ischemia, or it may be also be due to exposure of microbial toxins, or sometimes it is due to burns, or maybe a physical or a chemical injury. Physical or a chemical injury. So what are the four main causes of necrosis? Ischemia, exposure of microbial toxins, burns, physical and chemical injuries. Okay. And next, coming to the morphology of the necrosis. So what happens to the cell in during necrosis? Okay, first there is increased eosinophilia, that is there is increase in the eosinophils, and you can see large amorphous densities where in the mitochondria. You can see a marked dilation in the mitochondria. Okay, those are called the large amorphous densities. Okay, and you can also see discontinuities in plasma organelle membranes. Okay, and there is also aggregation of fluffy material. Maybe that may be due to the denatured proteins. Okay, and also you can see amorphous debris and some myelin figures. So what is myelin figures here? Myelin figures means the walled phospholipids. So lipids. Wall means there are concentric phospholipids, that is called myelin figures. Okay. And next, coming to the characteristics of necrosis. What are these characteristics? So there are mainly four characteristics of necrosis. What are they? Local inflammation, denaturation of intracellular proteins, enzymatic digestion of lethally injured cell. Lethally injured cell means that is nearer to the death. Okay. So enzymatic digestion of lethally injured cell and leakage of cellular contents through damaged membranes. So whatever the cellular contents are present, if there is necrosis, obviously the membrane will be damaged. Then whatever the cellular contents which are present in the cell, they get leaked out. Okay. Next, coming to the nuclear changes during necrosis. Okay, so there are three patterns in nuclear changes. How many patterns? Three patterns. What are they? Karyolysis, pycnosis and karyorexis. So what is karyolysis? In this the basophilia of the chromatin may fade. What happens? The basophilia of the chromatin, that may be fade. Okay. So what this will lead to? This will lead to loss of DNA because of enzymatic degradation by endonucleases. Enzymatic degradation by endonucleases. Okay. So what happens in karyolysis? First, basophilia of the chromatin will fade. Okay. Next, what will happen? There will be a loss of DNA because of enzymatic degradation by endonucleases. And next pattern is the pycnosis. So what is pycnosis? Pycnosis is nothing but nuclear shrinkage, where you can also see increased basophilia. Okay, here what will happen? The chromatin condenses into a solid and shrunken basophilic mass. Into a solid and shrunken basophilic mass. Okay, that is pycnosis. And next is the third pattern is karyorhexis. So in karyorhexis, what is happening is the pycnotic nucleus is undergoing fragmentation. What it is undergoing? Fragmentation. So, with the passage of time, the nucleus in the necrotic cell will completely disappear, right? Because after these three changes, there will be no nucleus, right? So, there after this pycnotic nucleus gets fragmented, there will be no nucleus. So, there is no nucleus. Okay. So this is about the definition, characteristics, causes, morphology and nuclear changes in the necrosis. And the next part is the types of necrosis. So how many types of necrosis are there generally? Generally there are 5 types of necrosis. What are they? Coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis and fibrinoid necrosis. Okay. So first we will discuss about coagulative necrosis. Okay, so what happens in coagulative necrosis? The architecture of dead tissues is preserved. That is, there will be a shape to the dead tissues. Okay, they are not irregular and also they exhibit firm texture. And you can see denaturation. Denaturation of what? The structural proteins and the enzymes. Okay, so what happens when there is denaturation in structural proteins and enzymes? This leads to the blockage of the proteolysis of the dead cells. What it will lead to? It leads to it will block the proteolysis. So there will not be any proteolysis in the dead cells. Okay, so where this coagulative necrosis is generally seen? It is mainly seen in the solid organs like heart, liver and kidney. Okay, but it is not seen in brain. You have to remember this. It is not at all seen in brain. Okay, in brain you will see the liquefactive necrosis, but in remaining all the solid organs you will see the coagulative necrosis. Okay, and next, the localized area of coagulative necrosis is called infarct. You can see in this diagram that there is a wedge shaped infarct here. This is the kidney, okay? So here you can see the wedge shaped kidney infarct. Okay, so how are these necrotic cells are removed? These cells are removed by phagocytosis. By what they are removed? They are removed by phagocytosis of what? Of cellular debris. So the whatever the debris is there after necrosis, that is removed by phagocytosis by infiltrating leukocytes. Okay, by infiltrating leukocytes. So how the necrotic cells are removed? Whatever the cellular debris is present, that undergoes phagocytosis by what? By the infiltrating leukocytes. Okay, so this is about the coagulative necrosis. So next we will learn about liquefactive necrosis. But before going to the liquefactive necrosis, here I want to tell about another necrosis, that is gangrenous necrosis. So what is gangrenous necrosis? Firstly, this is a typical coagulative necrosis. That is, it is a type of coagulative necrosis itself. And where can you see this? This is generally applied to the low limbs, and that too to the lower leg that undergo necrosis involving multiple tissue planes. And generally, you can see in the gangrenous necrosis, there will be a lots of pain, and that will be a foul smelling. The gangrene will be foul smelling even. Okay, but in case of if the gangrenous necrosis is occurring by a bacterial infection, that will lead to the liquefactive necrosis. Okay, so coagulative necrosis is by the dry gangrene. Okay. But during bacterial infection, you will see the liquefactive necrosis, that is the wet gangrene. Okay. Next, coming to the liquefactive necrosis. So what is liquefactive necrosis? It is characterized by digestion of dead cells. Okay. So what happens after digestion of dead cells? Whatever the tissue is present, that will change into the liquid viscous mass. Okay, that is itself telling you in the definition only, right? Liquefactive. So whatever the dead cells are present, that is being changed into liquid viscous mass. So where it is seen? It is seen in focal bacterial infections and fungal infections. But why it is seen during these infections? Because the microbes which are present, they stimulate the accumulation of leukocytes. Okay, so microbes, what they do, they stimulate the accumulation of leukocytes. And what this will result? This will result in liberation of enzymes. Okay, and that will lead to your necrosis. Okay, so what is the characteristic feature of liquefactive necrosis? You can see presence of pus. So how is the pus? The pus is creamy yellow in color, and what it is composed of? It is composed of dead leukocytes. Okay, so hypoxic death of cells within the CNS often manifests as necrosis. So here what you are telling is whatever the CNS related necrosis are present, that will be mostly the liquefactive necrosis. Okay. So here you can see an infarct in the brain, that is showing the dissolution of the tissue. Okay, so that infarct is present in the brain. So before I told you, in brain means that necrosis is liquefactive necrosis. Okay. Next, coming to the caseous necrosis. Okay. So what is caseous necrosis? So first we'll learn about this word. What is caseous? Caseous means it is cheese-like. Okay, that is a friable white appearance. What is caseous means? Cheese-like. Okay, you can see here in the diagram, it is cheese-like color and friable white appearance you can see in the diagram, right? So that is caseous necrosis. Okay, and in the microscopic examination, what you're going to find, there are structureless collection of fragment cells and amorphous granular debris within a distinctive inflammation border. Okay, so these two together in the microscopic examination tells you that there is the presence of granuloma. So what are the microscopical examinations of granuloma also? That is structureless collection of fragment cells, obviously, because when there is necrosis there will be no structure, right? So that you are telling here, the structureless collection of fragment cells. Amorphous, again you are telling there is no structure. Amorphous granular debris within a distinctive inflammation border. Okay, so where you can see this caseous necrosis, it is most often in foci of tuberculosis infection. Okay, so this is more common in tuberculosis. Remember, this is more common in tuberculosis. Okay. Next we will see about fat necrosis. Okay, so what is fat necrosis? It refers to the focal areas of fat destruction. Okay, so what this will result? This will result in release of activated pancreatic lipases into the substance of pancreas and peritoneal cavity. So the pancreatic lipases will be released into the peritoneal cavity. So where you will see this? You will see this in the condition of acute pancreatitis. Okay, so what happens in acute pancreatitis? What happens is, first there will be leak out of acinar cells and there will be the liquefaction of the membranes of fat cells. Okay, so what happens, whatever the lipases which are present in the fat cells, they get converted into the triglycerides. Okay, and this triglycerides again they get converted into the fat cells. So whatever the fat cells are present, these derive the fatty acids, right? So fatty acids are derived from the fat cells. So these fatty acids get attached with the calcium and form some chalky white areas. You can see in this diagram, right? See, chalky white areas. So that is called fat saponification. So what is this called? Fat saponification. So where you're seeing this in acute pancreatitis. And what kind of necrosis is this? It is fat necrosis. Okay. So what you will see in the histological examination, the foci of shadowy outlines of necrotic fat cells and basophilic calcium deposits, that is this. Okay, so you can see the calcium deposits surrounded by an inflammatory reaction. Okay, so this is about the fat necrosis. So coming to the last type of necrosis, that is fibrinoid necrosis. So where this necrosis is seen, it is seen in the immune reactions involving blood vessels. Okay, where it is seen in the immune reactions involving blood vessels. Okay, and it typically occurs when complexes of antigens and antibodies are deposited in the walls of the arteries. You can see over here. Okay, here there is a fibrinoid necrosis in the artery. Okay, so what happens here? When there is a leakage of immune complexes along with fibrin, that time you will able to see the fibrinoid necrosis. So how this will be appearing? This will be appearing as bright pink and amorphous appearance in HND stains. Okay, so it is bright pink. You can see in this diagram, right? It is bright pink. So this together is called immune complex along with fibrin is called fibrinoid. What is that? Immune complex along with fibrin is together called as fibrinoid. Okay, so where it is seen? It is seen in some vasculitis syndromes, like you can see this in polyarthritis nodosa, and also you can see this in acute rheumatic heart disease. Okay, and you can also see this in SLE and also during malignant hypertension. Okay, so this is about the necrosis and types of necrosis. Thank you for watching.